For today, we're going to define what policy is. We'll review the structure of New Jersey state government, which will include the legislative process, the budget, and then also how a bill is signed into law. We'll also talk about how do you advocate for your bill. And then we'll also do a live demo where we'll be able to read and interpret bills together as a group. And then we'll wrap up with our group discussion. So let's start at the beginning and let's talk about what is policy. So policy can take on the form of a law, which is statute or regulation. Essentially, we can think of policy as a course of action that is going to be made to address some type of issue. So policy is made in response to an issue that needs our attention. Policy is what the government is choosing to do to solve that problem, and also what it's choosing not to do. So policy really reveals the priorities of the government, whether it's explicit or implicit. Policy is also made by the government, even if the idea originates from outside of it. And policy making in of itself is an ongoing process. There isn't a clear beginning or a clear ending. I think many of us would agree that it's not just one bill that needs to be passed to improve midwifery care in New Jersey, it's multiple. So when we think about policy change, it's really something that happens over time, and it also can experience many barriers throughout that process, depending on the political climate. So it's really an ongoing process that evolves over time. So the question is, what is the connection of policy to midwifery care? So we know that there is a maternal health crisis in New Jersey and also nationally, and it's causing so many preventable deaths. At the same time, we also know that midwifery care is just one solution that can help address the maternal health crisis. Now, the problem is the statute in New Jersey that governs and that oversees midwifery is very antiquated. It hasn't been updated in more than 100 years. And so when we think about the policy changes that are needed to invest in midwifery, we really have to think about policy as a forefront at the beginning. And what sort of changes do we need in order to build that robust midwifery workforce in order to address the health crisis that we have here in New Jersey, but also nationally? So now moving on to thinking about New Jersey state government. New Jersey has its own state constitution that outlines the role of its government. So similar to the federal level, New Jersey state government is also divided into 3 equal branches: the legislative branch, executive, and also judicial. The legislative branch is made up of 2 houses, which is the Assembly Chamber and the Senate Chamber, and they're responsible for creating or enacting laws. The executive branch includes the governor, the lieutenant governor, and then also state agencies, and they're responsible for carrying out the laws and also for running state programs that have been instituted by the law. And the final branch is the judiciary branch, which is made up of the Supreme Court and many lower courts. They're mostly responsible for interpreting the law. So the judicial branch is the final authority that basically translates and explains what does the law mean. And they're also responsible for resolving disputes. So we're going to start with the executive branch. The governor is the head of the executive branch. They're elected every 4 years, and they serve for a 4-year term. Governors can't serve for more than 2 consecutive terms back to back. They're responsible for signing bills into law. They also oversee state departments, the agency boards, and also commissions. They also have the power to be able to call the legislature into a special session outside of their regular meeting schedule. And they're also able to grant pardons, and they're the only person that is able to call on the National Guard. The lieutenant governor is next in line if the governor is unable to serve their duty, and they also serve for 4 years alongside the governor. For the judicial branch, the Supreme Court is the highest court, which means that they hear cases that is related to the Constitution and other major issues. The Supreme Court is made up of a Chief Justice and 6 associate justices. The governor also appoints judges to the Supreme Court, as well as the Superior Court, with the approval from the Senate. So judges can serve for 7 years, and after they've been reappointed once, they can serve until they're 70 years old. The Superior Court is where most trials take place, and it's also made up of three divisions. The first one is the Appellate Division, and they handle appeals from decisions that happen in the lower courts and that happen in state agencies. The Law Division also hears cases from its criminal and civil division. And then the Chancery Division is made up of the General Equity Division, which basically focuses on disputes that are related to contracts. And then it's also made up of the Family Division, which basically focuses on legal matters that affect families and children. So I'm going to pass it over to Max, who's going to focus on the legislative branch, and we'll tie in how does our advocacy interact with this branch.
Good morning, everyone. So I'm going to dive right into the legislative branch. So as many of you know, the legislature has two houses. It's made up of a 40-member Senate and an 80-member General Assembly. What's interesting is, despite the fact that the General Assembly has more members, they run on a 2-year election cycle, whereas the Senate follows a 2-4-4 election cycle. This simply means that state senators are elected for 2 years, then 4 years, and then another 4 years in a 10-year cycle. And assembly members are only elected every 2 years. It's important to note that the assembly chambers are located in Trenton. That's why when you guys are going to give testimony, when they are voting on pieces of legislation, all that's done in the State House in Trenton, like it's been done for centuries. And as Armini had pointed out in the executive branch, the person that's really important there is the governor. The person that's really important here in the legislature is the Senate president and the Speaker of the Assembly. So Senate President Nick Scutari and Speaker Craig Coughlin. Why are they so important? They are important because they ultimately decide how the legislature functions. They decide the meeting schedules of when committees shall be meeting, how frequently legislation will be voted on. They essentially create the board list. A board list, you'll hear that terminology a lot among staff and legislatures. It simply just means the list of bills that are going to be voted on. And they pick which of those bills that made it through committee will be hand selected to be on the board list. And then there's also something called the supplemental board list, which is when they decide at the last minute, hey, you know what? Maybe we should add a few more bills. And usually it's because other people have reached out or other pieces of legislation have gone through committees. So they have an incentive to add even more bills. And so they have that power to pick that. Another thing that they are empowered to do is that they are able to pick the committee chairs. So the chair of health, for example, Assemblyman Conaway has now become Congressman Conaway. There was a vacancy. It was Speaker Coughlin who picked who would replace him. Could you please put the names? Do not worry, I have a whole slide dedicated to them. But yes, I will put their names in the chat as well for you. Yes, so as I was saying, they are really integral. So how do they even get picked? The legislature votes for them. So members of the assembly voted for Speaker Coughlin to be the speaker of the assembly, and vice versa for Senate President Nick Scutari. Something else to note is that the Democrats are the majority in both houses. So why does who the majority has matters? You want to be strategic when you are trying to get key pieces of legislation to move throughout the legislature. Currently, we have a large majority in the between the Democrats in the state of New Jersey. It's not like the largest majority in the world, but it's a significant majority. And they've had the majority for quite some time. That's not to say that if it was flipped, you would want to pay attention to the Republicans who, if they had the majority, because they would then be the ones determining which pieces of legislation goes on the board list, which pieces of legislation ultimately end up on the committees. And so when you are picking a legislator to sponsor your piece of legislation, you want to make sure that you're keeping track of like what committee this person sits on. Um, are they a new member? How long have they been there? Are they up for re-election? You want to know if people are up for re-election. They're more inclined to do pieces of legislation that impact the community than you'd be expecting to, rather than in a year where they might not have to do that. So these are one of the reasons why having the majority is important. It allows you to have strategy. And then to my right is the congressional map. This map shows New Jersey's congressional districts. There are 12 districts in total. Each district elects one representative to serve in the U.S. House of Representatives in Washington, D.C. This is different from the New Jersey State Legislature, which has its own districts, and we'll talk about those too. So knowing which district you're in helps you know who you represent or who represents you and who you can contact about health policies that impact midwives, moms, and babies. For example, if you live in District 10, it used to be Congressman Donald Payne Jr., but he unfortunately passed away. He has now since been replaced by LaMonica. So Congresswoman LaMonica McGyver is now the congressperson. And it's important to just keep track of those things because the federal laws can impact what's happening in the state oftentimes. And this is also important because midwifery can be impacted by your voices, and your voices can help shape those laws. Next slide, please. Okay, so it's important to understand the legislative schedule. The legislative session lasts 2 years, so 2024 to 2026. Each session runs for 2 years, and in January of even numbered years, and then in the next even numbered year. So again, 2024 to 2026. But it's important to know what happens in an odd number year. An odd number year is often known as a lame duck. So after the November elections, but right before the new legislature is about to take place in January, there is a strip of time in which the legislature is essentially fighting to get pieces of legislation in before the session starts all over again. Because once lame duck ends, once the odd number year ends, then they have to start that legislation all over again. So you guys might have noticed with the past midwifery bills, you're like, why, it was really close. It was going through committees. It was speaking to these people, but then it never made it on the board list, or it had one more committee it needed to go through. And now we have to start all over again. This is why you have to start all over again. You likely were going through something during an odd number year. Now, if there's a piece of legislation you have out right now that is really crucial and you really want to see that piece of legislation move, we are in 2025, which means we are in a lame duck year. You want to be persuading and speaking to legislators now about, hey, this legislation's important. We really want to see this move. Hey, can you post this piece of legislation? We really think it's important because during lame duck, people have to be really strategic about which pieces of legislation they want to move, and they may not always prioritize the legislation that you want them to do. Something else to note is the budget calendar. So budget resolutions are usually due in May, and the state budget deadline is usually due in late June. And our fiscal year is from July 1st to June 30th. Why does it matter about the state budget? So you can actually get, and I'll talk about this a little further, but you can actually get things like language related to midwifery care implemented within the state budget. It's not always about money. You can also have financial funding for a piece of legislation included in the budget. So let's say you have a piece of legislation right now that you really care about. Let's say it's really moving. It's like made it through both committees. All you're waiting for right now is for the speaker or the Senate president to put it on the board list. You might want to speak to a legislature about getting funding for that bill if there's not already funding in the bill, and you can do that through budget resolutions. And I'll talk more about budget resolutions in greater detail. So election years are every odd numbered year. As we discussed, all 80 assembly members and some Senate seats are on the ballot, which can influence what gets prioritized. So overall, timing matters. If lawmakers want a bill to become law, they need to move it before the session ends, or they risk having to start from the scratch. So you want to pay attention to the schedule so you can see what's going on with your legislation. You might be being told like it might be 2024 and you're like, hey, you really need to do this, like hounding them, and they're like, hey, it's actually not that serious, but it's better to move legislation during an even number year than an odd number year because there's less competition. Next slide, please. Okay, so the budget process. How does the budget actually work? In the context of the midwifery work that you're doing, when I talked about trying to add language to the budget, the way that let's give that as an example. The way that you would go about doing that. Let's say you want specific language about midwifery care in the state budget. You would meet, this is the best timeline. You would meet with a state legislature January or February. You want to meet with Assemblywoman Spate, you want to meet with Assemblywoman Pinto-Marin, you always meet with the budget chair. Always meet with the budget chair, always meet with the Senate Majority Leader, always meet with a legislature that is absolutely known for advocating for midwifery care, someone that you know actually cares about this work and values it and would put time out of their day to advocate for it. An example of that person would be possibly like Assemblywoman Swain or Assemblywoman Spate, people that have done midwifery legislation in the past. So what you would do is you'd send out an email in January or February asking to meet with them. You want to have met with them by March, have a presentation prepared. Why does this language need to be in the budget? Why does this funding need to be in the budget? Why does it matter? How does it impact New Jerseyans? Why is it integral, especially during years when there's not a lot of money in the budget? They're trying to make cuts, and you want to make sure that you are not on the chopping block. And the only people that can advocate for the budget is the legislature. The executive branch, the governor, he gives a proposed budget in brief where he basically outlines things that he wants to be in the budget. He pretty much gives out like a dry bone outline of the budget. But what the legislature gets to do is they get to add more things to the budget. They get to add language about certain programs. They get to add funding for certain programs. They can even advocate for funding for pieces of legislation in the budget. So after you've met in March, you want to start testifying at budget hearings in April. You want to pay attention to budget hearings in April to see what are people talking about. Do people know about your cause? Are people aware of what you're talking about? Do you actually think if you it's is it enough to just speak with the legislature? Do you need to present in front of the budget committee to let them know why this work is important, why it's integral, and why it needs funding? And then once you've done your budget hearings, budget resolutions are typically due late May. As a staffer, that's usually when you get them done by. In May, you want to continue to be communicating with the legislature. Hey, Assemblywoman Spate, thank you so much for agreeing to do this budget resolution. Is there anything else? Do we know how much it will cost when speaking? You guys often do that math yourself. So when you do your presentation, you want to come with your own numbers. Like, we want to create this midwifery pilot program. We went to this group that did the math for us, X, Y, and Z. It's going to cost us $300,000. This is why it's going to cost us $300,000. This is why it matters. And then let's say you get the budget resolution in. A budget resolution also needs co-sponsors. So now that you've gotten your budget resolution in, the work is not done. You need to be reaching out to members of the Senate and the Assembly to co-sponsor your budget resolution. Something that I did not mention that's important to note, a budget resolution is just as strong as a piece of legislation as meaning which sorry, I'm reading the chat, meaning essentially like you have a better chance of your budget resolution getting added if it's if it's basically in the Senate and in the Assembly. So if a senator says yes and an assembly member says yes, you have a higher chance of someone taking your resolution in. And getting co-sponsors on both ends is the best way to do that. like once they've been added. Next slide, please. Okay, so now we are going to talk about assembly leadership. So we talked about the assembly speaker. We know what the speaker does now. We know that he essentially has control over how the legislature functions. Who is the majority leader? Right now in the assembly, that is Louis D. Greenwald. So Assemblyman Greenwald is the majority leader. These people ultimately have influence as well in what ends up going on board lists. They have influence, um, they have influence over what decision the speaker might be making. The minority leader also speaks similar to the majority leader, speaks on behalf of their party and has influence over what they tried to make good with the speaker to get key Republican pieces of legislation on. I only say Republican because they're the minority leader. If it was flipped, and the Republicans were in the majority, then the minority leader would be Democratic. People that you guys really need to know are the health chair, which has recently become Assemblywoman Carol Murphy, the budget chair, Assemblywoman Pinta Marin from Newark, Aging and Human Services. A lot of your midwifery and Medicaid and healthcare legislation will go through this legislation as well, go through this committee as well as health. So that's Assemblywoman Shanique Spate, also from Newark. Appropriation Chair, very important chair. Anything that costs money is going to go through appropriations, and you want to make sure if your bill is going to cost money, which it likely will, because we're talking about medical services and providing quality care, that is not something that is cheap. It likely will go through appropriations. You want to know Assemblywoman Swain very well because you want to have her advocate to put your legislation on her agenda in hopes that the speaker keeps it on there. Next slide, please. Appropriations is different from budget if I did not mention that. Um, Budget basically deals with the state budget, and appropriations deals with bills that just have finance a fiscal amount connected to them. But in the Senate, budget and appropriations is one committee, so it just differs on which house you're in. So for the Assembly Speaker staff, who are the people that you need to connect with to get the speaker to be aware of your cause and problem? These two men are very, very important. Dan Harris, Chief of Staff, and he is the Deputy Executive Director at the New Jersey General Majority Office, which means he has a lot of power and he has a lot of understanding of legislation. He is a very intelligent man. However, he is not a midwife. So you might want to tell Dan Harris more information about your program. You might want to reach out to Stefan Lally, who's Deputy Chief of Staff to the Speaker, and you want to share information with them about why that information is important, why midwifery matters, why it's imperative that they move this piece of legislation that you guys have been advocating for. And they might have questions. Well, didn't we do a doula bill? You have to explain to them doulas and midwives are not the same. And they're open to learning. So next slide, please. So Senate leadership. Key people to know in the Senate. Senate President Nick Scutari does the same exact function as the Speaker. Senate Majority Leader Teresa Ruiz. She does the same thing as what a minority and majority leader would be doing in the Assembly House. Senator Ruiz is a well-known advocate for maternal health and women's rights. She is someone that not only holds a lot of power, but also advocates for maternity care. That is someone that you guys should know. That is someone that like you should be connected to. No different from the women that were on the other slides. Pinta Marin, Spate, Lisa Swain. Like you would need to know these women. And then for the Republican leader, it is Senator Bucco. For Senate Health, Human Services, and Senior Citizens in the Senate, that's just one big committee. So the person for that you guys might already be familiar with and you guys have worked with before in the past is Senator Vitale. Senator Vitale is also not a midwife, not a nurse, but he does tote to care very much so about healthcare and about advocating for women's health. And so you want to try to build an authentic and genuine relationship with him, at least an informative one where you're able to give him information. Senate budget and appropriations is just like what we talked about last time. So next slide, please. This is Jessica Cohan. This is the chief of staff to the Senate president. Chief of staff, what does that mean? As a chief of staff, it can vary depending on the office, but they typically tend to be the person that is most knowledgeable about what the legislature has going on in their schedule, their life, and their policies. They typically tend to be the policy director as well, typically are quite knowledgeable on the person's positioning and belief system. So they would be a good meter of knowing whether or not a member is interested in a piece of legislation. So let's say you really want to meet Senate President Nick Scutari, but it's impossible. You saw him at an event, you couldn't get to him, but you bump into Jessica. Jessica's actually kind of more important to talk to than Nick Scutari. He's really busy. But Jessica, her job is to make his life easier. And she's going to be able to have a wealth of knowledge. And you want to email her, you want to contact her, you want to build a relationship with her. Next slide. Thank you. So how does a legislation even become a thing? So an idea is developed, then a bill is drafted by the Office of Legislative Services. They will create a draft. During this draft form, this bill can be amended various times without having to go through a committee. This is the only time it can be amended without going through committee because it hasn't been introduced yet. Once the bill is introduced, it has a bill number. Then it will be referred to a committee. And then committee action refers to the bill going through committee and finally being amended. So that's like when it can finally be changed officially after the bill has already been introduced. Second reading is when a bill has gone through all the appropriate committee steps and now is eligible to be on the board list, which means it's eligible for a vote. House vote just means um, House vote just means that they either voted for it in the Senate or they voted for it in the Assembly. There are three governor actions. Um, or sorry, there's a second house, so it either goes through the Senate, it starts in the Senate and then it goes to the Assembly, or it goes through the Assembly and starts in the Senate. Something really important to note that a lot of people don't know is whoever gets the bill to leave the House first gets the credit for the piece of legislation. So if Assemblywoman Pinta Marin moves a bill out of the assembly first, the bill will leave as a Pinta Marin bill. So you might wonder why certain people, when you're giving legislation and you're determining whether or not you want to give it to an assembly member or a senator, you might want to make a choice between the two and then allow them to pick who they want as their counterpart because they're going to want to have that bill leave the House first. So that's just a strategy thing to keep in mind. There are three governor actions that can be done, and they're called absolute veto, which means it's an absolute no. And it on the governor's desk. He's not doing it, or she's not doing it, whomever the governor ends up being. Conditional veto. It means that the governor isn't necessarily fully saying no. They're just saying, if you tweak X, Y, and Z, then it's a yes. But until you fix those things, it's not a yes. And then there's pocket veto, which we're going to bring back lame duck, where the governor would have made it a conditional veto, but because it's lame duck and they've ran out of time, it becomes a pocket veto, which ultimately just means we ran out of time. We didn't have time to make it a conditional veto. You wouldn't have had time to fix the issues. So I'm going to pocket veto it, which means your bill does not go through, but you do ultimately have to start all over again because that happens during the lame duck period. But if you don't have to go through a veto and the governor signs it, then it becomes a law. Oh, sorry. Next slide, please. So, the Office of Legislative Services is a nonpartisan team that helps support the legislature. Their job is to help lawmakers turn ideas into actions. They do it without favoring any political party. First, they write bills, meaning if a lawmaker has an idea, OLS is actually the one who drafts the legal language to make it a real piece of legislation. They're often lawyers, so they could benefit from having your language and skills in writing midwifery pieces of legislation because oftentimes they don't have that background. They have to do research to draft that information. And so building a connection with some OLS staff or even possibly hosting a workshop with them to explain to them the work you do could be quite beneficial. OLS also helps revises bills through amendments, making sure they're clear, legally sound, and do what the lawmaker actually intends. So you really want to make sure that the people writing your bill or making sometimes a really good way to help OLS if you want them to write a piece of legislation for you is to write the legislation yourself. We actually prefer it because you have the language, the verbiage, the skills, you guys are the experts. It's actually so much more beneficial. So in short, OLS is essential. They're behind the scenes experts, making sure our laws are well written, researched, and responsible, all while staying nonpartisan. Next slide, please. So how do you advocate for a bill? You know who the key people are, but what do you do with that information now? So you want to build relationship with key legislators. You want to be stalking what kind of policies they're on, who sits on the health chair, who sits on the Aging and Human Services Committee, who is more likely to vote on maternal equity pieces of legislation, who introduces a lot of maternal equity legislation, who is in a leadership position and a leadership position in which that could advance your legislation. So, like Assemblywoman Hatter, for example, she chairs a committee that deals with children and women. Some of your midwifery legislation could very well be referred to that committee after going through health or aging and human services. So you want to build a relationship with Assemblywoman Hatter, for example, and her staff. You want to mobilize support through a coalition by flooding emails and calls to legislatures. They actually pay attention when their emails are flooded. I've seen bills get taken off the board list because we received over 300 emails about something. And I've seen the vice versa, where because we got a lot of emails about a piece of legislation, that they actually started to decide, hey, we're going to put this up. There's so much support for this bill. And you want to be calling your committee chairs. You want to be calling your state legislators. You want to be calling the speaker's office, the Senate president's office, the majority leader's office. You want to be calling everyone that sits on the committee in which you want the bill to move. This is all how we strategize as legislators, as a chief of staff. Like, I often use organizations and use groups such as yourselves, like experts such as yourselves, to further mobilize legislation because you guys actually know what you're doing and people want to listen to you. It's just knowing that your voice is powerful and you need to advocate for your bill. Next slide, please. So this is an example of an email to send to a legislator when wanting to meet with them or trying to have them consider a piece of your legislation. So something that I highlighted in this email is I highlighted statistics about New Jersey. So as you know, New Jersey continues to face one of the highest maternal mortality rates in the country, with stark racial disparities affecting Black and Brown mothers. Expanding midwifery access has been proven to improve birth outcomes. So, talking about a little bit of scientific information, then talking about we appreciate your leadership in maternal health issues. What can we do to help support and get this bill posted? This is what you would do if this legislator, it's their bill and you want their bill to move. You let them know, like, hey, I have a coalition of 300 or so women, of advocates, of activists that really care about this work. How can I support you? And they will let you know, hey, we need you to mass email people. We need you to come to the State House and testify on legislation when it comes up in committee. Things like that are integral and putting things like that in your email, like, hey, I want to support you. Hey, like, what can I do to ensure that this legislation moves further, goes a long way. Next slide, please. So we keep talking about committees, but who shapes the committee agenda? There are there are committee aides who work directly for the committee. Their job ultimately is to understand all the bills that are in their committee and understand which bills are more likely to move. They are really interesting because they ultimately have the ear of the chair. So they might say, hey, I was talking to a midwife and this bill keeps coming up and I heard you mentioned it a few times. I really think we should put it on the agenda. And that's kind of how those things go. They will make suggestions to the chair sometimes on what bills should go in their committee. Um, so why is the agenda usually late? This is a common question that we get asked. The agenda is often drafted and created by committee aide, staff, and the chair. That's three different people working together on one project. The final approval has to then be approved by leadership. Again, that's either the speaker or the Senate president. Sometimes they'll even take bills off the agenda and replace them with something else. That's why you want to have a good relationship with the speaker and you want to make sure that they know about your cause because maybe one day they'll put your bill on an agenda. The agenda is usually late because it's going through so many different hands. So who actually has a say in the agenda? Ultimately, at the end of the day, the speaker makes the final decision, but the chair is the one that picks the bills. The committee aide advises, the chief of staff advises, but the speaker or the Senate president ultimately confirms and locks in the final agenda. So if a bill keeps not getting put on the agenda, someone you might want to talk to is Dan Harris in the Assembly. You want to talk to Jessica Cohan, Chief of Staff to Nick Scutari, or you might want to talk to the committee aides who are the key people to talk to. Next slide, please. Okay. Have you ever emailed a legislator and realized like, oh, they didn't respond to my email? Um, Chances are if you're trying to email off the website, your email is going into a different outbox. As a former staffer, I can let you know that the best way to email your legislature is to have their direct email format. So for emailing assembly members, you're going to put ASW, which is short for Assemblywoman, or ASM, which is short for Assemblyman, the person's last name at njleg.org. An example is Assemblywoman Pentamarin at njleg.org. That's who you would reach out to if you wanted to talk to about the budget or speak about legislation and try to get her support on something. For senators, it's the exact same process, except it's the abbreviation for senator. So an example is Senator Ruiz at njleg.org. For legislative staff and OLS staff, it's the first letter of the first name and their last name at njleg.org. So an example is C. Farrell, which is Assemblywoman Murphy's policy director. She, remember, is the health chair. You probably want to get familiar with Connor Farrell. Next slide, please. Okay, so how to find your legislators. Let's say you're not familiar with the website. These links here are a great way to just directly put you to the legislative roster, and you'll be able to see every single person in the Assembly and in the Senate and figure out what districts they're in. And you can even go through the roster and see how they voted, what bills they voted on, and things of that nature. And next slide. Um, this is just online advocacy tools. So this helps provide additional information, such as tracking bills in the legislature. So you could track any bill related to movement on midwifery using websites like gov.net. NCSL is a personal favorite website of mine. It's a great tool for looking up legislation in other states and getting inspiration. So let's say you keep hearing rumblings about a California bill, this California bill, this California bill, and you want to compare it to another bill that you're really interested in Colorado. You can pull up both those bills on the NCSL website. And GovNet will tell you when a bill is going through committee, when it's going through when it's on the board list, and you can even like track like with alerts to so that way you're not constantly looking at the website because sometimes the website gets updated late. Um, yeah. And next slide, please. Thank you. So these websites just provide news updates, legislative priorities of the Democratic and Republican parties of the Senate and the Assembly. These web pages are also a great resource to stay informed with what's going on in the legislature. It's kind of like their own social media tool in a way. Another place that you can pay attention to what's going on in the legislature is on their LinkedIn page.